Hello, everyone. I'd like to introduce Mr. Muhammad Abdul Qudus, and I'd like to thank him for helping us preparing this video on how to deal with ISCP website and how to get the most benefit out of it. When we moved to the UK, we spent a lot of time understanding how to navigate it and how it can help us progress in our career. Either we are trainees pursuing training number or non-trainees preparing for CSER pathway. We hope you find this video useful, and if you have any comments or questions, please send them to us. And I will leave Mr. Abdul Qudus to introduce himself as well.
Hello, everyone. As Amira said, my colleague, I am Mohammed. I'm ST7 trainee in Southwest Peninsula in England. And here we go. We'll start with this presentation, which I hope is going to be casual and just focuses on the most important points about ISCP, and I hope it's going to be helpful for you. We will start with a few slides just to lay the ground, and then I think the bulk of the talk will be live. I'll share my screen. I'll log into my account, and we will show live how to navigate ISCP and how to deal with that. So we can see the slides, Amira, yeah?
Yes, yeah, I can see them.
Okay. All right, so the first question is, what's ISCP? So this is the navigation guide, and then the aim of this talk. These are the aims that we're hoping to achieve by the end of this talk. So we will explain what's ISCP, who needs to use it, and then the most important bits, which are how to set up a placement and get your regular meetings and reports recorded, and then the workplace-based assessments and how to fill them, how to assess others, and along with some other evidence that you can store on ISCP. And we will touch quickly on how to reduce the cost of using ISCP. So that will be the aim of this talk. To start with, as I said, what's ISCP? ISCP is a website, and it's the main platform that all surgeons, so it's not only for general surgery, it's for all other surgeries as well, orthopedics, urology, so on. In the UK, it's the main platform in the UK that surgeons use to assess each other. It has two functions. One is the assessment, and it's a verified assessment. And the other benefit, or the other usage of ISCP, is to store your evidence. And it is meant to be one stop, one place where you can put almost all your portfolio in an electronic form. So this is how it's meant to be. But some parts are a bit weak, but in general, it's a very good resource. So who would use it? Obviously, trainees. If you're getting a training number in the UK, it's mandatory. You have to use ISCP. This is the way. This is the formal way to be assessed and to record your progress as a trainee in the UK. So that's for trainees. Or obviously, if you are not a non-trainee but hoping to get a training number or working towards a training number, then the sooner you get to ISCP, the better, because it will help you to prepare for the interviews as well. For non-trainees, I've written here that it's highly recommended, but not essential. It is very important for your CSER, and you will need it if you're planning for a CSER. But I'm aware that some people will choose a trust grade or associate specialist route, and hence maybe it will be less important for this small group of people. But if you're working towards a CSER, you'll still need it. So that's the who. Now we will, as I said, there are two big parts of of the ISCP where you need to focus on. We need to focus on this in this talk, mainly because there are many details. There are many little things that you can do with ISCP, but the two big things are setting a placement that's for trainees. Again, it's mandatory, and getting regular meeting, monitoring your progress. And for trainees, this is a 3 meeting every 6 months, as many people will know. For non-trainees, the main pathway is via appraisal, but you still can set up a placement and get regular meetings. There are options to do this as a non-trainee as well. So we'll show this when we go live. The second part that we focus on, and probably the most important part of ISCP, is the workplace-based assessments, or the WBAs. There are different types, and they are very important for monitoring your progress and for your certification. So if you are a trainee, to get the CCT, there are some requirements and some numbers of these workplace assessments. And even if you're working for a CISA, you will still have the same. The main point for a CISA is that you're trying to replicate the evidence that is required for trainees. And hence, the best way to do this is essentially by using the same tool, the same platform that the trainees use, which is ISCP. And within this, the WBAs. There are few types of WBAs. The most important ones are CBDs and PPAs, and we'll talk about these briefly in a minute. So they are the most important because essentially these are the two types of PPAs that you need for certification. For the CBDs, you need to be level 4 in all critical conditions, and we will show the list for critical conditions. So every specialty, general surgery, orthopedic, or so on, will have a list of critical conditions that you need to be covered by CBDs. And before certification, before getting to the end of your training, you need to prove that you are competent at level 4 in all these critical conditions. KEXs are less important for registrars, still required, maybe more important for SHOs, same for DOPS. And then we'll move to PPAs. Again, you need, there is a list of index procedures for every specialty. And again, you need level 4 by 3 different consultants in all index operations. And hence, CBDs and PPAs are very important, and it's important to start early with these because you need to show progress over the years. This is the best way to present your evidence, to show that you progressed over the years from, let's say, level 2, level 3 to level 4, and to acquire the sufficient numbers for your certification as early as possible. So we'll in a minute we'll start showing how to fill these. And we'll show how to get the critical conditions and the index procedures, how to know what to fill and how. As we said, there are some other types of the WBAs, like the assessment of an audit or teaching or the multi-source feedback. We'll talk about these briefly as well. All right. So before we go on a live account, I will mention this quickly. It's very important. The annual subscription for ISCP is £260, which is a lot of money. It's but the good news is you can reduce this, and the way to do this is by asking for tax return, as the subscription fee can be regarded as an employment expenses. Most of our listeners will be maybe SHOs or registrars, and I think most of us will have some part of our income tax paid at 40%. People who are in the UK already will know this, but the point is, by asking for tax relief or tax return, you can slash 40% of your subscription. So essentially, instead of paying 260, it will cost you about £150. The two main pathways to do this, main ways to do this, are either via a P87 form, which is the simple way, but is a bit limited to a few things, including ISCP. So you can apply by using a P87 form, and you can Google it, and it's actually very straightforward. The other way is obviously is a bit more complicated, but it's more flexible, which is the self-assessment. Again, people who are in the UK may be more aware of these things, but just keep it in mind, because it will save you a lot of money, not only on ISCP, because you can get some money back from your GMC registration, from Royal College subscriptions, things like MDU, PMA, if you subscribe to this. So that's very important topic, but it's a talk for another day. All right, so these are the slides. Amira, do you have anything to add to this introduction, or shall we go straight to the live now?
No, let's go live.
Okay.
I think it was a really useful introduction.
All right, so now I'm going to share my my screen. I'll log into my account, and we can see how it looks. So can you see it now, Amira?
Yes. Yeah.
Very good. So this is the website, iscp.ac.uk. You obviously, it's like any website. You need to register. If you don't have an account, you need to register an account. I think you'll need your email address and maybe your GMC number to register an account. Then you get this home page. Now, if you look here, you have some tabs up here. The most important ones really will be the dashboard, ad, and portfolio, but we'll explore the other ones very quickly. All right. So the menu, the most important thing in the menu is actually the surgical curriculum. So if you go to the surgical curriculum, it will give you a list of different specialties. Let's say general surgery, and then if you go to the link, it'll give you the general surgery curriculum. These are the things that you need to know, things that you need to cover in order to get certified. And obviously, you can prove that you cover these things with different ways. One of them is obviously the exit exam, the FRCS, and the other ways are your logbook and then the WBAs that you will be filling on ISCP, as well as obviously the consultant's report, and we'll come to that in a minute. So really, the menu, this tab is, you will use it less than the others, but it's very useful to have a look on the curriculum at an early stage to prepare yourself to what you need to cover, what you need to know. We'll go straight to the dashboard because it's important. So the dashboard, you have notices. This is essentially the way ISCP talks to you. If they need to alert you to a message that you have to respond to, you need to pay your fee, the subscription fee, or whatever else, it comes to notices. Work in progress. This you will need this a lot, and I'll actually have a look inside. So work in progress is things that you filled in, but they're not submitted yet. So you can see here, this is a PPA and a CPD that I've written. I've already written these, but I haven't submitted them to my consultant. This, you can see the name there, before they validate it. And the usefulness of this, if you have them here, you want to edit them, you can get into them and you can edit them before you submit them. And also, if you submit a WBA and you want to retract it back, because you want to edit it, you want to add something, you need to delete something from this, you can retract it. And when you retract it, you will find it here in work in progress. And then you can click on it. I'll click on this one and you can find it, and then you can edit again. So that's that. Also, it's not only for the WAs. You will notice here that I've uploaded this paper. This is a paper that I was part of. It's not published yet, and hence I'm putting it just to remind myself when it's published to submit it to my portfolio. So you can use it this way as well for the other evidence. Messages is basically, again, the messages you get. Most of these will be people that asking for you to assess them. So I'm a registrar. I assess a lot of core trainees and SHOs. So they will send me their assessment here, and then you can log into it and follow the link and assess them and fill out their assessment. We will jump straight to this one, which is training history. And this is what we talked about when you said that ISCP will record your progress over the years, and it doesn't matter if you're a trainee or non-trainee. If you go to the bottom here, this one I wasn't a trainee, but I added a placement just to monitor what I was doing, and you even as a non-trainee you can set. If you see here, TBD is a training program director. Obviously, I wasn't a trainee here, but you can set it as demo. And with this, you can record all your placements, all your jobs, and who was your supervisor. And you can even set up meetings similar to what the trainees will do. And then it tells you that this is validated if you have done all your meetings and you had all sign-offs. It will be validated like this. And this is the history of my placements. So you can do it. The point is you can do it from outside training. As a non-trainee, you can still set it up. And obviously, when you are a trainee, it's mandatory, so you have to do it.
So when you're not a trainee, then you'll need them to ask them to have like an education and clinical supervisor, so you can put them, or you will put your consultant at least as your supervisor, and then he or she can sign it off for you, right?
Exactly, and it's actually a very important. It's actually very helpful. As we said in the brief presentation, the main pathway of assessment for non-trainees is the annual appraisal. However, if you set up a portfolio like this, you set up a placement like this, and you go to your consultant and say, well, I want to have a formal assessment and meetings, maybe not 3 and 6 months, let's say 3 in a year, not necessarily exactly like a trainee. It will set up the scene. If you in your first 2 weeks, the first month, ask for this, it will help you to put some objectives, some goals for you for this year, even as a non-trainee, and will help you to progress. And I honestly think that it helped me a lot, because when you go to your consultant and say, well, these are my objectives, it shows that you're keen to be trained, you're keen to progress, you are organized, and all the.
If your hospital doesn't give you like an educational supervisor or clinical supervisor, then you can push them using this as like, okay, I have this, I need a name to put on, and then you can do some meetings with them.
Yeah, exactly. I think it's a very important thing to do as a non-trainee, and I personally, it helped me personally a lot. So I would recommend it, even though you don't have to do it. It's a very useful thing to do. So yeah, so moving on, my profile will be just your personal information and things like that. Upload a CV. You can, as I said, you can use ISCP as a store for your evidence and for all your portfolio. And here, hence, you have this CV part where you can upload and update your CV as you go along. Then enrollment and training information are mainly meant for trainees, and it's just it records your training number and what placement you've done and things like that. The last bit I want to speak about in this dashboard is rate others. So here you will see that I've completed 119 WBAs for others. And it's a good record because you can use this as evidence that you are engaged in training others. Like it's because for the interviews or for certification, you need evidence that you are involved in teaching others and training others, not only being trained. And this is a very good, a very useful record of all the assessment that I've filled for other people. So as a registrar, you will be filling assessments regularly, I hope, for core trainees and SHOs. F1s use a different platform called Horus, but for the core trainees, you will find all the assessment that you've done here. So this is a very useful record of everything that you was involved in, and you can use it as evidence for teaching. And that's the dashboard done. We'll move to learning. Learning is very similar to if you go to dashboard or to the training history. It's essentially another way to look at your training history, but with more detail. The detail here is it tells you what placement you finished all your reports and all your meetings on. So here, this was before my training. I was trying here to get some of the meetings done. I created learning agreement on some of them. So at least I've created learning agreement, which, as I said, sets up the scene for you before your job, before a year in the specialty, to tell your consultant, tell the department that these are the goals that I want to achieve. So even before my training, I used to do this, but I wasn't very proactive in finishing all the meeting. Obviously here, I started my training, and then it's mandatory. You have to go through all the meetings. So you have the objectives, the midpoint, and the final, and you get a final report, obviously. So yeah, so learning. This tab is just your training history, whether you're a non-trainee or a trainee, but with a bit more details. And obviously, if you click to the objectives, it takes you to the objectives that you set for this placement, which is very important, very useful for you to go back and see how you progressed through your career. So not much more really in this tab. Now we come to the most important part of this talk, which is the WBAs and how to fill them. And it's very intuitive, as you can see. Add is to add them, to add a new WBA. And portfolio is to see your portfolio and the WBAs that you've done before. So if we're going to add to start with, first of all, you can add a placement. And again, even as a non-trainee, I'll stress on this point again, you can add a placement. If you're starting a job as a non-trainee, you can put it as a placement, then ask the department to appoint a supervisor for you. You can give them the name. It will ask you for a TBD. You can put a demo as a TBD program director as a non-trainee. So it's this is how you do it, to add a placement. Here you see a e-logbook. If you've been here in the UK for long enough, you will know that there is a separate website for the logbook. But fortunately, ISCP and e-logbook talk to each other, and whatever you record in e-logbook will be also recorded here. Will come to ISCP in this option. And from here, if you click to this, and it will show that your logbook, your surgical logbook, which is not working now. But yeah, it comes for portfolio actually. So the e-logbook is here. So this is my logbook, and then you can add operations, you can edit operations, like you would do in the e-logbook website. So that's very useful. As I said, the idea about ISCP is they're trying to get all the evidence that you need, all your evidence in one place, and including the operation logbook. These options I don't really use a lot. Do you use them a lot, Amira? Journal entries, PDBs, and rotas?
No, not really.
Oh yeah,
I
I don't
use the
really.
minimum.
Yeah, I don't really tend to use them a lot, these ones. So
No.
yeah, but they are there. If, PDB is your personal development plan. If you want to put
Yeah.
that, if you want to record
You
your
can use
rota.
it in your, yeah, you can use it either maybe in your appraisal, or you can use it.
Yeah, and the rota I think is important for Caesar, because for the Caesar they will ask you to provide a few years of your rota to prove that you had a
You've been involved in
a
clinic
broad
and
practice and you've been covering emergencies and everything. So if you want to record this, you can record it here. So it could be useful, but I don't tend to use this a lot. All right, so we move now to the most important ones, WBAs. So we said the most important ones are CBDs, the case-based discussion, and at the bottom here is the procedure-based assessment, the PPAs. And as I said, they are the most important because they are important for they're required for certification. So there are very specific requirements in terms of CBDs numbers and levels, and in terms of PPA numbers and levels, and hence I will focus on them. So for this bit, I will go back to the draft that I've done before. So first of all, let's talk what's a CBD, a case-based discussion. So this is essentially to give an example, you see a patient in your on-call, let's say a pancreatitis. I'm sorry, most of my examples will be general surgery because I'm a general surgeon. So yeah, so let's say it's pancreatitis. You see a case of pancreatitis, and then you would use this opportunity to discuss the management of pancreatitis, how you deal with the management with a pancreatitis patient, how you diagnose them, how you manage them, and how you follow them up. And so you have this discussion with your consultant, and then based on this case, you record a case, a CBD, and it's meant to show that you have knowledge of the case and how to manage it. In this case, the case of pancreatitis. So it tests your knowledge essentially about the case. Now, the standard way and the recommended way to fill these, let's go first to my draft here. So this is CBD that I filled just before this talk as an example. So it takes you to this. You add, you get this, and then it asks you to add the date, who's assessing you, so this is the consultant assessing me, and what hospital. And then this bit, general strength, development needs, and the standard way and the recommended way to fill up a CBD is essentially that before discussing the case, you tell your consultant, you tell your supervisor that I want to discuss this case and fill it and record it as a CBD. So it should be agreed before discussing the case that this is going to be a CBD, a case-based discussion. And then these parts, the general development and recommended action, these things, ideally, you should be filling together, you and your supervisor. You sit together, you discuss the case, and you fill these things together. This is the recommended way, the standard way. And then you can put your comments here. You can fill some reflections and what did you well, how you would improve. And then again, you and your consultant can put some ratings on these things. How would they rate your clinical judgment, your communication, things like that. And then it asks you if this was elective or emergency. And then this is the important bit. So obviously it asks you what was the case. So you say what was the case that you based on. And then for the CBDs, and this is the new curriculum. it gives you this option. If you remember, we talked about a list of critical conditions for CBDs that you need to cover. So if you click the critical conditions, it gives you this, and then I'll obviously go for general surgery, and it gives you this list. And these conditions, all these conditions need to be covered by level 4 CBDs before your certifications. Obviously, if you're neurosurgeon, you will have your own list. If you're cardiothoracic, and you'll have your own list. And this case was a hernia, side obstruction. So I'll choose this, and then it records. And this is important, because it's with the new curriculum, ISCP will automatically record critical conditions and give you a report, give you a count. We'll show this in a minute. We'll give you a count of how many level 4s you had for these critical conditions. So you can have in a table form, you have all the list of all critical conditions, and you get a tick for the level 3, level 4 for these conditions, so you can monitor your progress. And this happens automatically with the adage of the new curriculum. People who were on ISCP for longer, CBDs that you filled before the new curriculum won't be automatically added to your table. So you need to be careful there. You have to add them manually, or tell your supervisors about them, because they won't be added automatically, unfortunately, because this option wasn't there before. So critical conditions are very important to tick this box. Very important to monitor yourself. Every now and then you have to look at the list of critical conditions, see how much you've covered and what you need to be covered. You don't want to get your end of just before your certification, and you find out that you still have few of these that hasn't been covered yet. And then after that, you get, this is the levels, 1 through to 4. And obviously the aim for certification is to get level 4s and all these critical conditions. And then again, it gives you a level for your performance. And then it gives you an option to save it as a draft. If you haven't, if you're not happy yet, you want to add things to it, then you can save it as a draft. You're happy, you submit it. Now, I just told you the standard way of filling a CBD, which you fill it together with your consultant and tell them beforehand that this is going to be a CBD. And this is recommended because it sort of focuses your mind, it focuses your trainer's mind that this is a session of training. And I can tell you, when you do this, they really try to give you something more, because it's very easy for these assessments to be very routine, to be very a tick box exercise, and just going through the basics very quickly, and it's really pointless. You don't really learn much from doing them. But if you set the scene beforehand and say, well, I want to learn from this, we will have a case-based discussion about this case, then in most cases your trainer will be focused to and keen to give you something more and go a bit more in depth. And I had this, and I get regular recommendation about, look at this review, look at the guidelines about this and that, and it's very useful to fill it this way, and it is the recommended way. However, life is different, and there are many ways that how it actually happens in practice. I will ask you now, Amira, what's your experience about filling these? Do you find that this is what you usually do, or you do something else?
No, I think it's useful actually, because sometimes even they might give you some teaching or tell you, oh, the best way you could have done this or that, or the best way to do this. So it's not just like a tick box. But if you allow me, I just want to add a very simple thing. For people who just started using ISCP, and if you're an experienced a surgeon, or you've been doing surgery for a while and then you started doing ISCP, then sometimes you pass by like a very simple cases and you think it's like, oh, this is very simple, I'm not going to put them. But actually, I think put them and just tick the boxes that it will cover the critical conditions, that if like maybe appendicitis or perforated appendix or something, you say, oh, this is a very simple case, I'm not going to put this, it's not like a complicated enough. Just put them, tick the box, and then next time use put a more complex case. But at least it counts on your progress. It gives you a number as well as it cover the critical conditions that you need to fill.
Yeah.
And
Yeah,
just I just want to mention a very stupid mistake I've done when I started using ISCP for the CBDs, which is the levels of training, the level 1, 2, 3, 4. So no one gave me any guidance how to use it. It's just, oh, you have to use the ICP, put your assessment on it. And then my understanding was like, okay, level 1 is that it's a simple case that anyone can deal with, which is like maybe an SHO or like a very simple appendicitis or abscess. So that's level 1. And level 4 is like, oh, this is a complex case. Then if I dealt with it appropriately, then this is a level 4. But actually, after a while, someone told me, no, this is wrong. Level 4 is that you've dealt with this as any experienced person, even if it's an abscess. If it's an abscess, put yourself a level 4 or 3, or depends on the case. Level 1 is someone still learning, or like an SHO, or someone who still needs to more experience dealing with this case. So this was a stupid mistake I've done. But
it's a very common mistake, actually.
Yeah.
People. When you first start using ICB, you don't recognize that it's actually all about your competence and assessing your competence for these conditions. And as you said, an abscess, you'll be level 4 right from the start, unless you're an F2 or an SHO, then maybe you start at a lower level. But yeah, that's a very useful thing to add, really.
Yeah, just because I made this mistake at the beginning, so I thought other people think about the same thing. And even when I tell other people who just joined or using ISCP, I tell them this is like, okay, this is mistake I've done. Don't fall in.
Don't do it. Don't do it.
Don't do it. Just put 4 or 3 or whatever. The thing it's not about the complexity of the case. It's about how you dealt with this case, even if it's a very simple one.
So you mentioned this. So there are actually two places for the complexity of the case and for your competence on the case. So if you look here, it says complexity of the case. So is this a simple case or a complex case? So you can for this box, for this drop down menu, you can, if it's an abscess, then it's maybe a level 2 because it's a really simple thing. But then the global summary refers to your competence
and how you dealt with it, and
and this is your level 3, level 4 that you need to. So both things are actually available for CBD in the CBD, but you have to make sure that complexity of the case is whether it's simple or complex, and then this is the global summary is your competence, is your level of dealing with this particular case. So both of them are here. So going back to how to fill them, you will find out that sometimes it's not easy to do it the standard way. And then after a while, if you're in a hospital for a long time, the consultants know you know them, and they know your level. Then sometimes you will fill it in retrospect. So let's say you've done an on-call the week before, and you've seen some cases, and now you want to fill a CBD, and that's all right. That's appropriate. And the recommendation is try to fill it as soon as possible, as close as possible from your discussion. So obviously you still have to have had a discussion about a case, and you're on call about a case, and then maybe the week after, try not to make it longer than this, because then you lose the details and all the specifics of the case. So you can do this as well. So you can fill it after the event, after the discussion, maybe a week after, 2 weeks after you fill it. and then you send it to your supervisor to sign it off, for you. So that's CBDs. I will move now to the second most important, the other most important type of WBAs, and I prepped here something. So that's a PPA. So as CBDs test your knowledge, the theory, your theoretical knowledge about the cases. PPAs, on the other hand, test your skills, and in particular your surgical skills. And hence, CBDs have a list of critical conditions that you need to cover. PPAs have a list of index procedures, index operations that you need to cover for your for certification as well. And to show you the list of, I'll go first, show you the list of the index procedures. You can go to e-logbook here. And let's go to report, see if it will give me that. So the index procedure you can see on the e-logbook website usually, and it's usually just a few operations. For instance, for general surgery, you have things like, this is going to give you a rather extended report.
The full report, yeah.
Yeah, that's a full report. So let's not get into that. But so anyway, so for the PPAs, there will be a list of index procedures, usually 5-6 procedures, and then depending on your specialty, you'll have some more. So as I said, for general surgery, you have appendixes, lap coulis, laparotomies, and things like that. And you have to prove that you're level 4 in all these index operations. Level 4 equates to being independent. You can do them independently. And for the PPAs, you need 3 level 4s. And the 3 level 4s will need to be different consultants. You can't get the same consultant to sign 3 of the same procedure. So then once you fill, so again, like the CBDs, you have to keep an eye on your index procedures and make sure that you are up to date with and progressing well in signing off your level 4s for these index procedures. And you go, when you go to the PPAs, how to fill it, it's the same concept like CBDs. Ideally, the recommended way is you tell your supervisor, you tell your consultant before starting the operation that I'd like this operation to be recorded as a PPA. And hence, again, it will focus your mind to observe all the steps. And again, if you do this, you will find out that your consultant or your supervisor will be watching more closely, and they can actually tell you, give you some useful feedback about all the steps pretty much, because this is how it's assessed in the PPA. So again, this is a recommended way. You tell them before the PPA that I would like to be assessed. I would like to record a formal PPA for this operation. And then hopefully you have some time, you sit together and you fill it like this. First of all, to ask you about the procedure, and then the date, the consultant, the hospital. Again, these are basic information. And then this bit is the consultant should fill this, or you fill it together. A general comment, your strength, where do you need to be developed, and then you can give a comment about the case, reflect. And here we go. So this is step-by-step assessment of this procedure. And then they need to assess you for everything, and then if they have further comments, they can put them here. And this is why I think if you tell them in advance before the operation, you get a better assessment, a meaningful assessment, something that will actually help you to progress and do it better next time. rather than being, as we said, a tick box exercise. So you go to the end of this, and it again asks you whether this is emergency or elective, and then like the CBDs ask you the complexity of the case. Is it a level 1 complex or a level 4 complex? Here it asks you if it's easier, average, or more difficult than usual. And again, this assesses your competency. And for the PPAs, there are a bit more. It's not 1 to 4. There's 1A, 1B, 2A, 2B to add more detail to your competency. And as with the CBDs, you can save it as a draft. You come back later if you want to edit things, or you can submit it straight away. So I will go to add and put a PPA to show it a different way. So this is how you get a procedure. You click, you choose your specialty, and then you choose the case. So these colorectal, elective, emergencies, and whatever, and then you choose it. Just choose this, and once you choose this, it will open up the rest of the assessment. So this is the first bit of the assessment, and this we went through these together. So that's your PPA. Now,
so Mohammed, if you go back to the choosing the operation or the procedure,
yeah,
if you're going to add a new one.
mm-hmm.
So if you go to general surgery, then you can see, yeah, so the ones in orange are the index procedure for this that you'll need. Just this is the.
No, there is a bit of discrepancy though.
Okay.
You would think it's all the so Hartmann's procedure here is not orange, but it's actually an index procedure.
Oh yeah.
So you'll find out that there is a bit of discrepancy.
Okay. Yeah.
So you actually need to keep an eye on the index procedures from
the curriculum itself.
From the curriculum or from the e-log book. It will show you the index procedures, and then you come to this list, and you pick them from here.
Yeah. Okay.
They should actually change it, and you're right. This should show you the index procedure, but it doesn't really. There is a bit of discrepancy here, so you need to be careful about that.
Okay. Yeah, that's good. Okay.
That's the point. That's a good point that you raised this point actually. Then so this is the most important two, CBD and PPAs, and we talked about how you fill them and how many you need for your certification and everything. The others are a bit less important, like KEXs. You fill them like the CBDs. It will be the same pretty much. You fill the details, put some information about yourself, about what's recommended action, how you performed, and the rest of it. But when do you use a KEX rather than a CBD? A CBD is purely theoretical. It is your knowledge, and that's it. In a KEX, there is a bit of more clinical, as in if you go and assess and examine the patient. So let's say, let's take the same pancreatitis case. If you just discuss pancreatitis as a case and the theoretical knowledge around pancreatitis, this is CBD. But if you're meaning to prove that I actually I assessed the patient, I examined the patient, I took a history, these are all clinical skills. And these clinical skills are best assessed by a KEX. And hence, it's really more important for SHOs and maybe junior registrars, because by the time you're an ST5, ST6, you are supposed to know all these basic examination, taking history. This is basics for you now. So I don't find that KEXs really help you after you, let's say, ST5 and above. What do you think, Amir, about that?
I think actually you can put all of this in the CBD as well. I know that it's case-based discussion is more theoretical, but you can say, oh, I've done that and I've learned that, and you can cover that in the CBD.
So yeah, I don't really find KEXs very useful, but they were still required for the trainees, really. So that's a problem.
Yeah.
They
I mean,
still asked us to fill them.
yeah, sometimes maybe when like yeah, an SHO or a junior registrar, and then you have something like maybe a bedside procedure, like you've done something where like drained the wound or examination, and you recognized it and you opened it, or something like bedside
Yeah,
or
yeah,
something. You can put it here. You can put it maybe, or some sort of this, like you felt something when you're examining the patient, a mass or something. But I don't
yeah.
know.
It definitely has a place. It has a place, but I think it's more for the juniors, for
Yeah.
SHO core trainees and maybe junior registrars. But after that, I don't think that you actually need it, or it doesn't really help you to progress. It's not
Yeah.
really meaningful for seniors really. The same can be said about DOPS. So DOPS is a PPA, but it covers more operations, not necessarily focused on the more critical or index procedure operations that you do. So again, it's very useful for SHOs. Maybe as a junior registrar, you can fill a couple, but um, it's once you're ST5 and above, it's not really useful.
But I think
So
there is a problem actually, because sometimes you cannot find a procedure in the PPAs and you find it in the DOPS. For example, if you're looking for closure of the abdomen, I think it's under DOPS, it's not under PPA.
yeah, exactly. But
So
closure of the
like
abdomen,
simple, sometimes like simple procedures, if you want to just put them and count them, it's not under PPAs. But if you're starting to use ISCP and you want to prove that you can do this, you might find
yes,
them under
yes,
DOPS. But
yeah. Oh, and that's the point about them being again useful for SHOs and junior registrar, because by the time you're ST5, you are
yeah,
expected to know how to close the abdomen and
yeah,
put laparoscopic ports and things like that.
yeah,
So you will find the more simple things under DOPS, and that's why it has its place for the more junior registrar and SHOs. But once you're senior again, it's less useful, and PPAs will be more relevant really. So again, for the more junior listeners, this is important, but the seniors will probably not fill many of these. And again, because KEXs and DOPS are not part of the requirement for certifications, the more senior you get, the more interested you be to fill these really, because it's not going to add to your certification
yeah.
anyway.
But
Then
if you're
after that,
someone, if you're an SHO want to go into training, for example, or even if you're a SHO and you want to see like show your progress to a registrar level, then I think it's useful that you fill them.
yeah, absolutely, yeah. Other things. So other things, we have the assessment audit, observation of teaching, and the MSF. So these are tools that you can use from time to time. So if let's say you've done an audit, you can ask a consultant to assess your performance on the audit, and you can actually present this as evidence with the audit itself and the final report from the audit. So it's something called a triangulation of evidence, and people who are trying to apply for the CESA will be aware of this concept of triangulation of evidence. And the point here is, if you've done an audit, you need to prove with more than one way that you've done it and you've done it well. So you can get the report and then get a presentation of the audit, let's say. So that's another piece of evidence that you've done the audit. And then maybe you fill assessments of an audit. So that's now you have triangulated your evidence. You prove that you can do the audit with more than one way. So again, with the teaching is the same. You can use this for triangulation of evidence, giving more evidence that you can actually teach. But specifically for teaching, the most powerful evidence is feedback, is to record feedback. And I'll show you here that some of the feedback that I had, you can record it, or you can store it rather on ISCP in other places. MSF is a bit different, is important for trainees. Trainees are required to do one MSF every year. MSF is basically feedback from your colleagues. and even as a non-trainee, you are required to fill at least 3 of these for your 5-year revalidation, because for your 5-year revalidation, you need at least 3 annual appraisals, which would include colleague feedback. And this is a very easy way to do a colleague feedback, the MSF. You just send emails and they fill an assessment, and then it gives you a final report with score and everything. And with it's very nice actually, and it's a very easy way to do it. So it is mandatory for trainees, and it's very, very useful for non-trainees for your annual appraisal and eventually for your 5-year revalidation. So it's very useful to know how to do it. So now we sort of covered the main workplace-based assessments, but this is not the only thing that you can do. As we said, you can record your progress, prove your competence, but also you can use ISCP to store all your evidence, all your portfolio. And here it gives you the option to add audits, prizes, courses, you name it, publications, whatever. And then even under miscellaneous here, if you have something that doesn't fit under any of these headings, you can put it at the bottom here. And I'll show you some examples of what I've put in. So it comes under other evidence in your portfolio, and you click that. Take some time to load. And then it gives you this, and this is a recollection of everything. So let's say, for instance, you get audits. I have 11 records, and these are the audits I've done. You click that, it drops down, and then these are the things that you will need to add: the date, title, who was the audience, your outcome, what are the findings, and then it gives you the option to upload documents. So that be your audit certificate, your presentation, your final report. All of this you can store in one place. And this is why another reason why ISCP is very useful, because you can have a full portfolio all electronic in one place, and you can come back to it in any time. You can add to it if you want to edit this, you can retract it. It will go to your work in progress, and then you can edit it and put it back. So it's very actually nice to deal with it this way. Other things you will find, obviously your research, your papers, your courses, if you have any courses, you can put your certificates. And here I said I'll mention this, so I'll mention it, teaching. So you go teaching, you can record your teaching sessions. And let's have a look. So this is a lecture that I gave to the F1s. And then you record when did you do it, what was the topic, and it gives you an option to add the attachments. And here we go. This is the feedback. This is the most powerful way you can record your teaching and give evidence to your teaching, feedback. So you get something like this. What was the content, and scores on the content, and any comments. So for people who are applying for CSAP, people for applying for the interviews, this is the most important piece of evidence for teaching, really. Not the certificates, it's the feedback. So here we go. So you get to add all these under add, and you can see them under portfolio, other evidence. And here, obviously, you can see all the WBAs I've done. I have 78 CBDs, closed cases, and the rest of these. After that, in portfolio, you can also see the summary. You will use this or we used to use this actually for the old version of the interviews. I'm not sure that they require this anymore. Do you know, Amira, if they require these summaries for the interviews now? They require them for the all version of the interviews, the STC interviews, but I don't think they need it anymore.
No, I don't know.
Yeah.
No, I think they required specific things, but not the whole. No, the whole.
Not the whole report. No, not
No.
like before. But anyway, if I've used it for the interviews, but it doesn't give you a very nice report, and unfortunately, I don't really find it very very nice. It's not very well presented, really. What do you think about that? It's rather long and not
yeah,
not
yeah, and it's not clear.
exceptionally
It's
organized.
not clear. Yeah.
So you get this, then you can download it, but it's still. I'll show you an example. You can let's go for PDF. So this is how you pull reports, how you get your reports, your portfolio summary, all the evidence. But it's as you see, it's rather long and not very well presented, I have to say.
I think you can choose what report you want as well. It's like if you want
Yeah.
WBAs only, or you want CBDs, or you want exactly what you want, I think.
Yeah. So there are ways to filter it and play with it and make it look a bit nicer. But I don't tend to use.
I think if you say viewing, then you can, I think, change what you want. Yeah, on the top.
Yeah.
When you go in viewing summary, I think you can, no, down under your name.
Oh, under my name. Summary. Sorry, yeah.
Yeah, I think the summary, I think you can choose what you want from. Okay.
I lost it. Under summary, you can filter what you want.
Yeah, you can filter what you want. You can choose if you want the whole summary, or you just want CBDs, or you want PPAs, or.
So here we go. That's your portfolio summary.
I think it comes from here, or I think from CBD you can put summary.
Here we go. Yeah.
So
that's it.
You can choose what evidence you want.
Yeah, and hence you get a more organized or a shorter report.
Yeah. Still long, and sometimes you don't know who's the consultant, who's not. It just shows the levels. I think it's useful in showing the levels and the operations that you have. But I'm not sure about the rest.
Yeah. So other bits is global objectives. These are the objectives that you recorded during your placement. So as we mentioned before, you add a placement, you set a first meeting, you put your objectives and you code them, and then all of them will come here. Learning agreements are the same. It pulls out all the learning agreement that you recorded during your career. WBAs requires falsification. This is the table I talked about before, where it gives you the WBAs and the critical conditions. Here it is in a table form. But again, I'll add that it will only record things that you uploaded after the new curriculum that came into effect. Anything that you recorded earlier will not come automatically to here. So I'm pretty sure that I've added more than this. I have more things ticked off, but because these things were before the new curriculum, it didn't add automatically, and then I have to manually extract them and prove them, which is a bit annoying for people who've been on ISCP for longer. But if you're just starting to ISCP, you don't need to worry about this, because it will automatically now record, as long as you tick the box for critical condition and record something for the CBD, it will automatically come to this table, and then you can monitor your progress. You can have a look and okay, I have level 3s, level 4 for this condition, but let's say, oh, this one is still lacking. I still need to fill one of these. So it's a nice way to have a summary and see how much you need and what's lacking. Equally here you go. This is the level of critical the index procedures for your PPAs. These are the ones that I have recorded. Again, there's some discrepancy here, so we need to be careful with PPAs, because it uses the PPA list, which is not exactly the same as the list of index procedures. So for the CBDs, this is very useful because this is actually the list of critical conditions, and this list is correct. But for the PBAs, you need to be careful, but it doesn't cover everything. So I would recommend that you use the CBD table. That's fine. But the index procedure table is not perfect, let's say. So you need to be careful with that. After that, ARCBs, if you're a trainee, it records your ARCBs. We had a look on this before. This is the logbook. And as we said before, well, I don't tend to use this a lot, to be honest, but other people might find it useful. So here we go. This is all what I have to say. Do you have anything else, Amir, you want to mention? Do we need to touch on anything else?
I cannot remember anything. I think you covered everything nicely. I learned new stuff as well myself today. So that's good. I hope it's useful to everyone. And if anyone has if anyone has a question or a comment, or they want to add anything, they can just contact us, and then either we can do another video, another part, or we can do a webinar and answer the questions. But I think we covered all the basics and everything today.
Yeah. We didn't go very deep with how you set a meeting and what you required with the meetings, and the new change in the new curriculum, or what's called the multiple consultant reporting. You have a tab here to trial it and everything. I think it's maybe if people want this, we can have another short video about these things, but it's mainly for trainees, really. But if people want to know about this, we can record it. But I think
at least we
for the very basics, this is enough.
Yeah, at least people can understand all of these steps and understand how to navigate this. I think when you start dealing with ISCP, I felt it's overwhelming with all of this, to know what to use for what and what to put in which tab. But I think that was useful, actually.
Oh, very good.
And I hope everyone find it the same way. And as I said, if anyone think that we missed something, or they want to add something or correct us or comment on anything, they just can contact us either on Twitter or Facebook or our email or YouTube, and then we can discuss what's next.
Yeah. Very good.
So I really thank you, Mohammed, for your time. And for this
very
useful and for this useful presentation. And thanks.
Well, till next time.
Till next time.
All right.